Thank you for joining us today. This is the second webinar of our Global DEI Webinar Series that we entitled Global Perspectives on Diversity, Equity, and Inclusion. My name is Cathy Huber. I'm the Senior Director for Global Initiatives and Scholarly Engagement in the GPS Alliance, and I will be facilitating and moderating this webinar discussion today. I'd like to begin today with an acknowledgement that the land that I and many of you stand on today is located on traditional, ancestral, and contemporary lands of the Dakota people. Wherever you find yourself at this moment, whether you are in Crookston, Duluth, Morris, Rochester, the Twin Cities, elsewhere in the US or in the world, I invite each of you to reflect on and acknowledge the peoples on whose land you live, work, and learn. Acknowledging the land and our history in this place is an offering of solidarity with and respect for Native nations and peoples who were here before us, are here now, and who will continue to be here in the future. Today's webinar is part of the Global DEI initiative launched by the GPS Alliance earlier this fall. The initiative was launched in partnership with many other people across the University of Minnesota system. And if this is the first time that you're hearing about the initiative and joining a webinar, welcome. We're glad you're here. We're glad you're here. I'll start with giving just a little bit of context about the initiative, so you understand what our goals are and where we're going. So historically, international education work was perceived to operate differently from diversity, equity, and inclusion work. International education was perceived to focus just on mobility, sending students back and forth. And DEI work was considered to be more focused on the domestic, working on issues related to social justice and equity within the borders of the United States. And you would see this well, you still see it today at our institutions, where Office of Education and Equity and Diversity offices are completely separate with different reporting lines from our international offices. And that applies not only here to the University of Minnesota, but really around the country as well. During the global pandemic and the racial reckoning in the summer of 2020, the conversation began to deepen around how are the goals of increasing intercultural understanding through global education and the goals of creating a more welcoming, equity, and equal and justice community for those within our borders. These two areas, these goals, we started to think more about how they're related and how they're connected. Even though we're different in some ways, there are broader ways, our broader goals of creating an environment that's more welcoming, inclusive, just, and equitable for all of our communities, including those that might not have been born and raised in the US, that might be here as international students or international faculty or scholars, as well as our US students who are studying abroad and are going into environments where there might be different definitions of diversity, who are bringing all of their own identities, right? And so how are all of these things connected, and how can we work together and really elevate this discussion about this intersection? So the goals of the initiative are summarized here. They are to engage and educate the University of Minnesota community about the intersection of DEI and international education. This is about raising awareness. This is about raising awareness, having the conversation, helping people to understand what this means, which is really important to provide the foundation to building and developing intercultural skills to bridge these areas. Another goal is to generate dialogue about diversity and inclusion through a global and an intercultural lens, and to really think about how the global and intercultural lens enhances the work of DEI. The initiative seeks to explore notions of diversity across and within cultures. What does diversity look like if you are in Japan, right? Or what does diversity mean if from a Cambodian or a Nigerian context, which our panelists will talk a little bit more about today? And what does this difference mean for international students, scholars who are coming to the US, and for our students who are going abroad? And finally, we seek to facilitate conversations about identity and intersectionality within a global context, and to really start to develop the skills to be more interculturally competent, to understand these complex issues related to this intersection of DEI and global education. So I'd like to now introduce our panelists. I'm very pleased we have two international students with us today. The first is Taiwo Aremu. Taiwo Aremu is currently pursuing a PhD in social and administrative pharmacy at the University of Minnesota College of Pharmacy, while doubling in a PhD program in environmental health sciences, infectious disease at the University of Minnesota School of Public Health. He currently sits at the University of Minnesota Senate, representing the College of Pharmacy as a University of Minnesota student senator. He's a researcher at the University of Minnesota Masonic Children's Hospital and Masonic Cancer Center. He is also the executive editor of the Public Health Review Journal and co-coordinator of the School of Public Health Global Health Work Group. Vongrathayuth Hingphith has served and worked in the public education and nonprofit sectors for more than 7 years prior to his pursuit of higher education in the United States. He holds a BA and an MA in education, specializing in curriculum and instruction from Royal University of Phnom Penh, and is pursuing his second master's degree in comparative and international development education in the Department of Organizational Leadership, Policy, and Development in the College of Education and Human Development here at the University of Minnesota Twin Cities campus. Currently, he serves as the Director of Communication for the CEHD International Student Community and is also a graduate consultant for the International Student and Scholar Services Office. Thank you and welcome, Taiwo and Yuth. We're very happy to have you here. So we'll start today with, I have a couple of questions that we have asked each of the participants to respond to, and they're going to start with setting the context from which they're coming from. So they will each talk about how diversity, equity, and inclusion are defined and talked about within their home countries. For Yuth, that's Cambodia, and for Taiwo, that is Nigeria. And then we'll invite them to share how DEI has showed up for them and continues to show up for them personally and or professionally. You will have the opportunity to ask each of our panelists questions. We have allotted time at the end for this, but because this is a webinar, you need to put your questions in the chat, and then I will ask them on your behalf. So please feel free to add those questions at any time, and we'll save them to the end. So Yuth, let's start with you. The first question, as I mentioned, was to talk about how DEI is defined from the Cambodian context.
Thank you so much, Katie, and hello, everyone. It's a very good afternoon. It's kind of a wonderful day. So, and definitely significantly different in terms of temperature from Cambodia, a country in Southeast Asia. Literally, we used to survive on tropical temperature, and now we're living in a kind of like sub-zero degrees and most of the time. So as many of us already know, I'm from Cambodia. So technically Cambodia is a very homogeneous country with typically a lot of diversity conversations are related toward the harmonizing of Cambodia in general. So majority of the populations are practice Buddhism, and majority of us are considered as Khmer, which is the current major race in Cambodia, technically consuming 96% of the population. But then when we're actually talking about inclusivity and equity, there's a lot of conversation that we actually address upon. So majority of the conversation will actually pinpoint towards the new conversations about the gender biases in majority of the field that we are working in at the moment. So technically there's a cultural biases toward women in Cambodia. Technically we are a very maternal community where women are actually upholding a lot of traditional values for the community itself. But then translating those into a conversation of education, career, and workforce, there has been a lot of ongoing push toward like changing the narrative of how women perceive in the community. What are some of the gender roles that is currently affecting the opportunity, access, and equities for women in different situations in Cambodia? Those conversations is continue on up until now, where now we actually reaching quite a good percentage of women girls in school, which we actually hitting 52% girl in education. However, still have a lot of conversations to actually push forward regarding higher educations, where the number of gender divide within certain fields or certain university or pursuits for higher education itself are still in a lot of questions. And if we actually talk about inclusivity, the country itself are currently looking into changing the narrative quite a lot. So due to the genocides that took place a while ago within the 1970s, there's a lot of issue with disability, specifically on physical disability. So when we talk about disability and access toward education or inclusivity, it probably looks and feels towards the conversation about physical disability, where we are attempting to support those and enable different type of population to be able to access to different type of skill sets, training program, work opportunities, and also education opportunities. And as we go on, this is actually an ongoing push. There a conversation on infrastructure changes within the system. So that include administrative processes, infrastructure of like school institutions to actually help facilitate all those conversations. So the differences between Cambodia and the United States help the gap and period we are in. That's right now we are still pushing towards some of the most prevalent, which is gender in education and inclusivities in terms of disability support to education itself. I know there's a lot more to define, but then I think these are some of the key highlights that are currently happening in general in Cambodia. And thank you so much for your time. I think I'm going to pass the floor over to Taiwo.
Thank you, Yuth. Taiwo?
All right, thank you. It's nice to be here, and it's a pleasure to notice so many of you here. Thank you for coming. I'll tell you a little bit about Nigeria. Nigeria is a West African country. It's the most populous country in Africa, with about 225 million people. It's the 6th most populous country in the world. In terms of the domestic diversity, we have about 525 native languages. But in case you don't know, the official language, which is the lingua franca in Nigeria, is the British English. Some people think we have other types of languages. I mean, maybe other type of language is our lingua franca. No, it's actually English. We have 3 main religions: Christians, Islam, and the traditional religion. And so the main issue of diversity in Nigeria, or issues of DEI, is religion. Interestingly, even though we have just 3 main religions, but religion is just a big issue. And during times of elections, politicians kind of use religions to divide folks, to canvass for votes for themselves. And that's because if you look at the dynamics, the distribution, we have about 55% Muslim, and then you have about 45% Christians. The traditional is roughly about 0.something%. And so to thrive in Nigeria, for instance, we've learned to respect the ethnic and religious differences that we have. If we must live as family back home, we learn to respect ourselves. I'll give you a very good instance. I'm a physician by background, and I recall that during my 2nd year of practice, I was in charge of drawing up a roster of doctors that will be on call. And so when we, because we have Christians and Muslims being the major religion in Africa, I mean in Nigeria specifically, we usually have the Christmas holidays the Easter holiday, the Salah holiday, and stuff like that. And so if on Christmas Day, as a Christian, you're supposed to be on call, you do not need to go talk to somebody in the management to request to go on Christmas holidays. Your colleague who is a Muslim would actually ask you to go home or tell you, don't come to work tomorrow. Tomorrow is Christmas, Merry Christmas in advance, and tell you to go. Just make sure you don't come. I'll cover for you. Same thing also happens when it's time for Islamic religion holidays. So it's just something that everyone just agreed to. I mean, it's not really an agreement. We just learn to respect, to understand ourselves, and to respect that differences. As long as we have done that, we would always thrive and live together as families. You see, when I was practicing medicine, I worked in the presidency. The person who actually was like a father to me, or is even till date, is somebody of the opposite religion. I'm a Christian, he's a Muslim. And from a different ethnic background, his is completely different. But because I'm willing to find a middle ground with him, listen to whatever he has to say, and he's also ready to listen to me, then we live together as families. In the entire presidency, they always say how Taiwo is the son of this man. Whereas we never knew each other from anywhere, but we just met somewhere, and because we're able to understand ourselves, we're able to live together as one. Let me stop right here so we can move forward. Thank you.
Thank you to you both. That, I think, set a nice foundation, and it's a good start for moving into the second section in our webinar, where you talk a little bit about how DEI shows up for you. So Youth, I'm gonna start with you, and the question I'd like you to respond to is, you mentioned that you're a master's student in the CIDE program here, and I'd like to know, how have the differences in the definition of DEI here in the US changed your research perspectives and your topics of interest?
Thank you so much, Katie. That's actually a very good question. So as you heard earlier, I started off with public education. So a lot of what I see are a conversation that take place within school. So since I got here, I was expecting, or actually at first I came to the assumptions that public institutions was probably a place where you actually take away specifically from the teachers, faculty members, and all of others people around. But then this particular conversation started to shift and change as that I remember the first semester that I had in the University of Minnesota was more on the idea of like how much I learned from the community of very diverse populations in general. So I was in a program that potentially have a lot of international students. What interests me the most is a conversation that we had about the differences in some of like education issues, social phenomena that are taking place in public education in their country. Those type of conversations become a melting pot. So when you're actually starting your journey in this conversation of diversities, where everyone else bring a little bit of something new to the topic, specifically when we talk about education in general, we tend to have these long conversations about what more can we do, how much can we help, and how much can we offer. And this in turn transforms into a lot of collaboration between classmates in terms of research and practices. I remember one of the most empowering moments was the conversations about how open it is to talk about sexual orientation here. It's a conversation that considered quite taboo back in Cambodia. So the academics conversation related to that topics kind of actually taking place easier in this setting. The concept of diversity and inclusions kind of give you that sense of like, what does each of the term values mean? Or potentially what are some of the social issue might look very differently in different contexts. And I think this contributes a lot into how you actually establish a research hypothesis and what could have been more for a particular topic, or what can we do more for a particular program, a project of intervention to help the community. So in this conversation, since I got to the United States, my research topic kind of like increased in terms of both amount and depth. And it has been a wonderful journey to just talk to different people. And that's oftentimes you just get back up with the new information that you kind of like learn from the contextual experiences of particular students. And then you just take away like a specific set of new questions to ask yourself whether or not your research are actually addressing all of those. So there's multiple lens and multiple views toward one particular phenomenon or social issue has been like the key driving factors for a lot of it. And these openness toward the conversations of like appreciations of different type of story, different type of values, different type of social definitions of the word itself has been like a great benefit, have been great and beneficial toward establishing hypotheses for research. So I think like that's just the research part, but of course, personally, you learn a lot from people, you kind of make connections, but then I think academically, as most of us are actually here for, or professionally as well, we kind of take away and taking things for the best, as like there's things that you learn outside of the books that count as like the most valuable aspects of the journey itself. Yeah, I hope I answered your question, Katie. Yeah.
Yes, that was great. Thank you. I think it's interesting because it's not something I think you brought an interesting lens to this in terms of how this intersection between DEI and global education can really impact a student's academic program, and thinking about what does that mean for research. And someone might have come here with an idea that I wanted to study this and I wanted to focus on this research, and then as a result of this, things have shifted and changed. So thank you for that perspective.
Definitely. It's always a divergent process of like synthesizing, and you probably would take away more than you expect this all the time when you're actually in a very diverse situation where everyone bring their own lived experience to creating a new narrative.
Yeah, that's great. Taiwo, the next question is for you. If you could speak a bit about how you as an international student, have issues related to DEI shown up for you in for your professional and your personal development?
That's a great question. Thank you so much. I would start with an illustration, and then I'll use that to give us some takeaways. Let's start with you and your home as an individual. When you choose to acquire flowers, pets such as dogs, cats, birds, they join you to become a member of your family. To help these new members thrive in your home, to help them succeed, you've had to pay attention, to understand, and to help them grow. You know, recently I was in the clinic, and one of the conversations I had with the provider is, when you want to manage a patient, it's good to go with the books, but sometimes, or in many instances, you need to use an individualistic approach. That you need to understand that the United States comprises of people from different backgrounds. So you need to understand our genetic differences. So if what you give ordinary patients is this particular type of medication, try to understand that maybe people from this particular tribe or country or part of the world react to this medication. So maybe you're thinking of a different line of medication. So 2 takeaways to illustrate what I'm trying to say, how DI has showed up for me personally and professionally. 1, seek to understand. You see, in Nigeria, communication is very important. And our major means of communication has had to be with your cell phone. You know, historically, you know, in the past, before we had the internet, we had to use letter writing. And then as technology came on board, we started having phones, mobile phones, we started sending SMS. And so currently, because we have the phones, people can easily send text messages. And so one big thing for us is early response. In Nigeria, if you ignore to respond a message, that's viewed as being disrespectful and rude. You see, when I became the executive editor of the Public Health Review Journal at the School of Public, at the University of Minnesota, one thing I told my team members is, let's share our phone numbers. Let's have each other's phone numbers so that we can communicate more efficiently. You could send me emails, that's fine. I could send you emails, yes, but so no one comes tomorrow and said, your email fell through the cracks, I found it in my spam, whatever. So you can always still send me a text message to say, hey, I sent you an email, can you just try and look at it? And to be honest with you, I've had two individuals that shown to understand this. The two of them actually tried to understand. I wouldn't mind to mention names anyways. I'll just mention two names. Dr. Shuma and Dr. Sadak. These two folks actually told me at some point, Taiwo, I think you might need my phone number so that in case we need to talk about, whatever, you need quick response so we can quickly do that. And so that has helped. They sought to understand me because that is what we do from where I come from. That has helped me in my personal life, and professionally, it has also helped me. One thing we don't do in Nigeria is we don't keep eye contact. It's disrespectful to look into you in the eyes if you're older in terms of age or professionally. We don't do it. So when we're talking to you, we're most likely gonna look down. It shows respect. But in the US, when I came here, I discovered that if you don't keep eye contact, it's assumed by some that maybe you're timid, you're not bold, you're not sure of yourself, or you're lying. Nah, that's fallacy. So that's just the difference that we need to understand. So you need to seek to understand the person. So keeping eye contact has affected me adversely when I got to the US professionally, but I had to try to unlearn just so I can keep up with the trend right here. I'll go to the second point quickly. For us, one big point is you need to be flexible, be kind, and reasonable to accommodate. You see, growing up, I learned and observed that you need to welcome people that are perceived as foreigners or visitors. And so if you come to a bank and we can perceive that you're a visitor, you're a foreigner, you're not a Nigerian, even if there is a long queue, we probably will ask you that, hey, can you go forward and get your money first? If we go for a job interview, you'll probably be considered first before me. So if you go for a job interview as a foreigner in Nigeria, you just be almost sure that you got the job. Why do we do that? We believe that foreigners or visitors should be made to be comfortable. For you to have taken that long journey to come down here, you aren't much, you're just a few of you, you're just like, we'll call you the minority, then you should be comfortable, we'll make you feel at home. Sometimes you don't even need to ask. People just have the best interest of you at heart. You cannot be hungry. Your neighbors will actually come knock on your door and say, hey, we got a lot of free food for you, do you want this? You can have it. Raw food that you can cook and stuff like that. People will reach out to you. So those are the two basic things that helped me personally and professionally, where I come from and how it has changed when I got here. Because here as a foreigner, as an international student, if I go for a job interview, I actually need to do more. I need to prove my point better than the locals. I mean, those who are domestic, I need to do more than the domestic student. When we go for job interviews, I'm most likely going to be the last person to be considered and stuff like that. Those are just the two differences I've seen. I think we can do better. Yeah, actually, we can actually do better. We need to learn the good of some of those other countries and see how we can improve ourselves. Thank you.
Thank you, Taiwo. I appreciate those comments as well. And there have been a couple of questions that have come in the chat, so I think it's a good time to address those. And the first question is, Youth, for you, And it has to do with the Muslim minority in Cambodia and what the DEI conversations are around the Muslim minority. And if you could also set up for those who might not know the context of Cambodia and the religious breakdown, if you could talk a little bit about that as a foundation, and then talk about the DEI conversations around the Muslim minority.
Definitely. Thank you, Katie. And that's actually a very good questions too. It's actually also, I think, first of all, in context, the Muslim populations in Cambodia are making up of 2 to 3% of the total populations. And technically the conversations around Muslim is that we identify them as Jam, but not all Muslim are Jam, or not all Jam are Muslim, and vice versa, not all Muslim are Jam. So in the context of policies and governance, there's no divide among races within our conversation in general. So we're expected to receive the same opportunities and access. There was a term that I think I remember up to now whenever we talk about ethnicity in Cambodia, is sharing the same fate. Sharing the same fate is actually associated with one of the darkest period of Cambodia, which is the Khmer Rouge, where a lot of people, it was technically genocide. So during that period of time, everyone else that coming out of during that period actually quoted the term sharing the same fate as they are progressing forward. But indeed, there were what we consider discriminations among the population of Buddhists and Muslim in certain aspects, as majority of the practice and standard of living are quite significantly different between the two religions. There were discrimination potentially within workplace as well. But in paper, everything was actually communicated in a sense that everyone received equal opportunity regardless of their religion. One of the biggest push I have seen so far as a public school teachers before was the introductions of the conversation about religions in the social science for specific high school grade, secondary grade, that include grade 7, 8, and 9. So the conversations of differences and appreciations of different culture was slowly integrated into the education system. But then there's, of course, a lot of economic divide between the Buddhist populations and the Muslim population, where we can actually identify some of the Muslim population within the lower bracket of the economic income. And of course, that's become a lot of key sectors. I'm going to also link into the next question as well, Katie, if that's okay. I think I saw another question that is quite similar in terms of like, how does that play out in some of the setting? So I think like that would play out in majority of the settings, as well as the issues of politics, as issues of economic divides, as actually the issues of development itself are coming into play. So politically, the population itself are currently in the political party would actually utilize religion as a form of pinpointing and addressing some of the votees. In other words, like buying votes through promises. But then it's like with the political systems that's right now, I don't want to go too political on this, but there was attempt to take advantage of the differences in terms of the gap in financial packages of those two type of populations to leverage in the setting. But then what concerned me the most as a scholar is the conversation is the issues that there's the lacking of literature regarding this particular topic has constantly being addressed in the education sectors, but not other sector as much as other sector emphasis on the income practices of the families within each of the religion, but not entirely about the social aspects of it. As there are conversations regarding health science, and Taiwo might also be aware of this too, the differences in terms of like how they perceive medicines in this particular conversation that kind of lead on towards those two. I know it's like a ball in the park. There's actually it's very critical to talk about this as of now, and it's also very important to also address this conversation too. As on paper, policies wise, everything seems perfect in terms of diversity, but then there are discriminations that exist but not documented. that actually becoming like an alarming conversations that potentially scholar can actually address and look into as well, whether or not in terms of standard of living, economic device, access to opportunity, education, discrimination within the workplace. All those conversations can be addressed and further look into the data, because right now all the data are reported from different development agencies. So there's a lot of gap and hole within literature to fully address this particular conversation in full. Yeah, I think that hopefully all that I know about this particular topic, and I feel like there's so much more to know about it, that the lack of literature sometimes can be scary. The lack of awareness and understanding toward it in a sense of like published documents was actually some things that we should actually prioritize as well.
Right, thank you. Taiwo, a question for you. As someone whose academic and professional career has been within healthcare settings, could you talk a little bit about what are the important DEI considerations related to patient care, based on what you've seen and how we understand DEI issues? Does that make sense?
Yes, I think I'll try to to say what I know. Hopefully I'll answer. I would do justice to the question. I would use my experience. First, I'll tell you what the literature says. Currently in the US, we spend, amongst the Western countries in the world, the United States spends the highest on healthcare. In short, what I'm saying is that the healthcare spending in the US, or the healthcare spending in the US, is higher than every Western countries. However, despite the spending, the outcome does not commensurate with what we're spending. So if you look at Switzerland, you look at Australia, you look at the United Kingdom, their outcome, they don't spend like us, yet their outcome is better than us. Why? I've had several conversations with individuals and groups, and my question had been for the last 5 years now, past 5 years or 6 years is, what's the cost? And it seemed we seem to have neglected or ignored the importance of diversity. We have a diverse population in the US. And if you look at those that are adversely affected by DEI issues, then you should look into some of those minorities. They make up a very sizable part of the population. And if we lose many of them in terms of health outcomes, poor health outcomes, then that culminates into what we understand federal, in terms of federal statistics or nationally. Like I said earlier, I said I was in a clinic, and the conversation was because of the way I was being managed. I trained in my country. I had practiced medicine in my country. Interestingly, Nigeria, medical school itself for us in Nigeria is 6 years. I spent 10 years. I cannot spend 10 years in medical school and not know what I'm doing. The way we're trained is such that by the time you're graduating, your professor would only allow you to go when he knows that in case he falls down in the middle of the night and they wake you up, you know what to do. You would resuscitate him with the little or minimal resources. If you look at Nigeria and most African countries, we're we call them low resource countries. We don't have so much of technologies. No, many times we don't even have electricity. But you must make do with the minimal stuff you have. When there is no light, you must still be able to deliver the woman that is bleeding and has a baby inside of her. You must make sure the mother and child are alive. It's at that point you're allowed to go. At that point, you're allowed to graduate from medical school. A couple of weeks ago, I was in a theater, the operating room here, and someone was finalizing her residency, was suturing, and was still fidgeting. And I was like, what? You're wrapping up your residency and you're fidgeting? This is what a medical student in Nigeria would do without even having to look too much. It's one of the easiest things to do. So the training back home is kind of thorough. And that's maybe because we do not have too much of technology. So we don't rely so much on technologies and stuff. We make the technologies as humans. We are the ones who create the computers. So if you can create the computers, you can create the robots, you can create all sorts. AI is garbage in, garbage out. So it is you that create all that. So if you can create that, why not be optimal? So that's the way we're trained. And so when I come back here, we have what we call implicit bias. It's not something that people really plan for, but it's just believed that when they see you, they feel you can take anything, you can absorb pain and stuff like that. And so, for instance, I go into a dental clinic and I said, I have toothache 10/10. I'm a physician, I know what to do, but I choose to go to the clinic and say, I have toothache, because I believe, let me submit myself to someone else to treat me. And I'm being told to come back, we don't have an appointment until 3 months' time for acute tooth pain. So, those are kind of the issues that I've noticed. All these kind of things kind of culminate into the poor outcomes that we have, DEI issues. So if you do not treat pain for somebody because you just assume it can tolerate pain, let's say the person now chooses to go to the streets to go take illicit drugs just to ameliorate their pain. They end up with terrible complications. Let's assume they come back with kidney failure. Now they have to come to the ER, and then before you know it, you have to spend so much money, insurance, to take care of the kidney. What you could have dealt with initially with just a few dollars, we end up spending so much money to deal with the complications because of the timeliness. And that's because we feel they don't know anything. They won't say anything. So those are the kind of experiences I've had, for instance, in clinics here. And I've had to challenge many of them. I've lost a family member here because of something like that. And that was because at the time I decided to say, let me just trust them to do their work. But when it got to a point that I could no longer stand it, it was getting too late. At that point, I introduced myself as a physician, and you could see all the attendings running and scattering around, looking confused. So, there's so many issues there. So I feel that, like I said earlier, when you see someone that is a foreigner, seek to understand them. If you understand them, you won't have a problem at all. Don't assume for them. We don't assume. A lot of people have assumed for me. I've had folks who assumed for me and told me things that, oh, come on, I don't want to say them here, but they assumed for me, actually, which is so wrong. Just seek to understand, ask questions. I've had people who ask me, hey, Taiwo, sit down. Can you tell me more about Nigeria and your makeup? Can you tell me about what you do and why you do those things and stuff like that? Cathy, I'm not sure if I answered your question well.
Yes, that's good. It was a big question, a big, complicated, complex question. So no, so that was great.
Thank you.
A question for both of you, actually. With this topic, with this global diversity, equity, and inclusion, with this intersection, how can this topic help faculty, staff, administrators on our campus be better allies, and not only for students, but also for colleagues who may not have been born and raised in the US. Youth, you want to start?
Sure. And I think it's like it's also a big question as well. I think it's like these conversations of global DEI is actually, it's more in practice than just concept. It's more about humans rather than policies and papers. I think I addressed this earlier too. Is like in paper in Cambodia, it seems like everything was homogeneous, everything was good, but then it is the reality itself that actually show a lot of differences, right? And like right now in this on campus, I believe like you learn best when a class is most diverse as possible. The diversity in terms of experience, live experience, special interests that actually bring and accumulate those particular type of like curiosity or intellectual curiosity that kind of drive a lot of people to institutions like us. And then for us to be able to do so, the activation conditions was actually in how a class is set up, how the system are set up to support. I know I might be biased because I'm actually in the international education program. So technically what I'm saying is probably a little bit more into, oh yeah, everyone, ideas, theories, concept are widely appreciated because we are driven toward that particular conversation. But of course, I do have conversations with students, and oftentimes is the how much staff, faculties, and peer listen to them. It's the conversations of like how you show interest in the diversity one particular student bring, either to a classroom, to a learning community, or to a system in general. What are some of the power of those voices that actually lead to student change? One scenario and one conversation was that at first last year, the first time I arrived, I was actually scared because technically you're going abroad for the first time for a long period of time, assuming, and you actually going into some of new culture that you were not experiencing or find familiarity with. And then the first thing that happened was that I was able to meet with, I think it was student staff that just listened. So those are the big first step of like how those conversation of global diversity, equity and inclusion take place, is that sense of like, how do you make a person feel like they are listened to when you are welcoming them to a community, specifically a diverse community like the University of Minnesota, to fully excel or thrive within this context, within this setting, right? So I think like I always remember the first conversation, it was unplanned. So I went to Burton Hall. We sit from 5 p.m. all the way to 8 p.m. when they kicked us out of the hall. The conversation was like this curiosity of like, oh, what did you do within your country about this? It was both a conversation about your personal life and your professional and your academic interests. So they were asking, you work in public schools, so where did this go? I learned more about the system in Japan. I learned more about like why the licensing program worked differently in the Hong Kong institution, and particularly like why the licensing program here or the training program in the United States can enforce and enhance those type of understanding. So those type of things happen within that space that we created. And I think like it's always important to always prioritize those particular sense of like belonging through the first sense of, in other words, through empathy and listening. So with empathy, it can go a long way in global DEI. And then from that, you will start seeing action because people only drive by motivations and expectations of things. And I think that's actually quite powerful. It's a powerful experience of the first semesters that I was placed in a class, I think it was 80% international student. So we were having this open space of conversations about different systems, different perspectives, different narratives toward a particular phenomenon ever in development and all of that. So it's not just on paper that you say diversity and inclusion should be approached this way, but the action and the spaces that was all around campus that actually create all of those. I hope this kind of answered your question, Katie.
Yeah, it does. And I think So Taiwo, I'll let you respond. And I think, the next logical follow-up question to this then is sort of what are the skills that people also need to work on to develop, as awareness around this is raised. But Taiwo, I'll let you respond to sort of how faculty, staff, administrators could be better allies.
All right, thank you so much. One thing I would pick first, I would just let you know about something that happens back at home. We're used to suffering and smiling. So no matter what is going on, for instance, when I got to the US, there was a time I was having a surgical procedure. Because back at home, you really don't complain, right? It's difficult. You just accept everything that comes and keep moving. And so despite that, I still needed to see if I could still go to class, notwithstanding what I was going through. I really didn't know who to talk to. I felt, well, if I tell them, nobody would understand, nobody would believe me and stuff like that. So because of that, because we can struggle, we struggle through a lot of things. We're not used to the fact of when it's little struggle, you say you have mental health issues, and then you're able to take vacation from classes, you take extension. It's not something we're used to. No, it's not something we do. Yet we are all humans that have mental health issues, yes. So one thing I think faculty, staff, and cohorts, everybody needs to understand is some international students would not tell you what they are going through. They won't say it. The honest truth is, I'm going through a lot, but I'm not saying it. The whole of yesterday, I was going from one hospital to the other, taking care of kids. This one is sick, one was on admission. Yet I had meetings I needed to host, right? I didn't know until in the middle of the night when my body was aching me. That is who we are. We just pull through it and hope that the next day would be better. I'll keep moving. So because we don't ask, I would request that seek to help them. For instance, international students come here and many of them do not have access to teaching assistantship, graduate assistantship. That's because they don't know. And they don't know how to ask. The truth is they don't know how to ask. And so because we're just a few of us, why not if you're an advisor, for instance, for a student, I feel that advisors should just make it a culture to reach out to the student who is an international student and offer them something. See whether they will tell you yes or no. They won't tell you no. They will tell you yes, and they will continue to tell you thank you till tomorrow. They will call their parents at home and say, this is the best person I've met in life in America, because this person actually did what you do. That's what my dad does, right? That's what my mom does. So I'm used to that kind of culture of them just reaching out to people and just helping them without them asking, because they feel or perceive that they need it. International students have a lot of needs, but they don't know how to ask. Remember, help them out. Seek to help them. Graduate assistantship is one big thing. I've interacted with so many international students. I have some friends who are currently doing they are done with residency, doing their fellowship. And while they were students at the University of Minnesota, they never had access to those opportunities. Until date, they are still hungry. So I just keep telling them, you have to move past it. So just please help them, reach out to them. They have needs too. I think that's just what I would say.
Thank you for that. Yuth, did you want to add something?
Yeah, I think you have a follow-up questions on like how it's actually looked like in actuality. And I think Taiwo actually mentioned a very good point. And the beginning of everything is the attitude that you show to your advisees, your peer, and your students, right? It's the whether or not, how do one perceive the term supportive? How do you perceive the term empathetic, right? And I find that very powerful, because for international students to be open first, we need to be able to actually see those attitudes in reality. And it might come very differently from one culture to another. And I think I do share Taiwo, not skepticism, but Taiwo ideas of that. For Cambodian, we smile all the time. We appreciate our senior. I was actually shocked. I think Taiwo asked, we had a conversation about calling a person by name and calling sir. So for us to call someone by name, it's take a lot of effort for us to do so too, because like it's a sense of respect that our country values very strongly. Like if I were to address my advisor, I have to include doctor or sir, because it's something very common for us to do. It's the idea of like showing sense of respect and hierarchy in a way, but that here is quite different. I feel like we are, as much as staff and faculty need to show those, us also need to start being open. And I feel like that's a powerful conversation we always have. Like I start understanding and adapt. I think Taiwo and I had a conversation about this with our previous call, but we are slowly adapting and learning in this situation alongside the staff and faculty that are actually helping us along the way. And I think like it's a cycle of like first just be empathetic and supportive, show the attitude of those in a specific ways, and then start accumulating the understanding and support and knowledge in terms of like how what student reacts to those particular situations or activity of actions, and then just normalize it with the conversations. And in other words, like the more awareness one possesses towards things, I know it's going to be very difficult to develop a global awareness, but then it started off with your circle of those you work with. To what extent are you able to communicate, support one another through all those process, and it's becoming an easier process moving forward too. Yeah.
Thank you both for that. I think that is a wonderful way to conclude our webinar. And I know there were a few more questions that came in to the chat, and I apologize that we can't get to those, but for those of you who ask questions that are really interested in the responses, feel free to reach out to me directly. I'll put my email in the chat, and I can, if you're comfortable, I can forward those to Taiwo and to Youth, and then they could perhaps, if they're willing to type out a response to that. I don't want to leave those hanging out there. And with 1 minute left, I'll say thank you to our panelists deeply for sharing this. We really, really appreciate this. I love having this conversation because it really puts a personal touch to this conversation, and it's helpful to hear from you, from your own perspective and in your own voices. So thank you very much for that. So there will be 2 more webinars scheduled for the remaining semester. There'll be one in March, one in April. The next one will be on March 14th. So watch for information to come out on that, including registration instructions. And it will be a similar format as this one, with having 2 to 3 panelists answering similar types of questions. And if you would like to provide us with some feedback, when I end the webinar, a feedback form will automatically pop up, and we would really appreciate it if you could fill that out. It just helps us to plan for the future. So thank you very much. And especially thank you to Youth and Taiwo. Bye-bye.